Season 1, Episode 12. Are those nagging aches normal or a warning sign? In this episode, we're joined by a licensed physical therapist, Jake McCain, to break down exactly when and why beginner runners should see a PT. We'll bust some common myths, talk about what really happens during a PT visit, and explain how working with the PT can help you not just heal, but run stronger, smarter, and pain-free. Whether you're just starting out or training for your first half marathon, this episode will help you understand your body better and give you the tools to stay injury-free and motivated on your running journey. Welcome to Running for Beginners, a podcast my buddy and I thought was needed for new runners to help them and show them what they'll likely run into on their journey, just like Jeremy and I did just over 3 years ago now. I'm your host, Mike Fleming, and along with my little running group for support, I have, with this 12th episode, taking you through 12 episodes this season on things we ran into that you will likely run into. This is Season 1, Episode 12, Should You See a PT? The Beginner Runner's Guide to Injury Prevention and Performance. We'll be right back after a quick message from our sponsor for this episode, Quantum Energy Squares. Quantum Energy Squares are an energy bar with caffeine and protein, made with 100 milligrams of natural caffeine equal to an 8-ounce coffee, and 10 grams of plant protein, healthy fats, and complex carbohydrates. Get the lift you love from an energy drink without the crash you hate. Perfect for exercising, midday snacking, work, school, and travel. Certified plant-based, gluten-free, non-GMO project verified, and kosher with no dairy, soy, artificial ingredients, or sugar alcohols. Quantum Energy Squares can be found at quantumsquares.com. They're endorsed by athletes and fitness enthusiasts. Quantum Squares offer delicious flavors like peanut butter, dark chocolate, and dark chocolate pink Himalayan salt. With over 2,500 five-star reviews, customers rave about their taste and effectiveness. Quantum Squares are a delicious, healthy alternative to conventional energy snacks. And for a limited time, if you use my promo code RUNWITHMIKE, you'll get an exclusive 25% off discount at your purchase. That's RUNWITHMIKE. In episode 10, we went over some of the common injuries runners deal with, and I spoke to a chiropractor and proprietor of a sports rehab clinic. This time, I'm delving into another injury prevention and recovery specialty, the physical therapist. I've been pretty lucky in my running journey. I haven't had but one small nagging quote-unquote injury that eventually went away. Some people have recurring shin splints, consistent low back pain, knee pain. Others are habitually tight or sore to the point that they stop doing what they love out of an abundance of caution. When I started running consistently, I was older, and what I'd call gym-wise, meaning that I knew my body well, and I knew the difference between muscle soreness due to usage and pain or discomfort due to strain, overuse, or injury. However, I know that I'm an outlier, someone not in the pool of the majority. That being said, some of you might not know how to tell if you're injured or not, or if it's the beginning of something serious that you've just caught early. I'm possibly a little different than most in another way as well. I've had 4 major surgeries in my life. 2 of them can affect my running if I don't listen to my body and take precautions. The upside of that medical history is the fact that all of the surgeries required physical therapy before and then afterwards in order to get me back to a semblance of normality. So, I'm personally aware of how valuable the physical therapist, or physio, is when it comes to injury treatment and prevention and overall recovery. In this episode, you'll also learn when to seek help, what to expect during a visit, some common beginner mistakes, and some easy ways to improve form and prevent pain. I'll be right back after a quick message from our sponsor for this episode, Clear Protein. Elevate your protein game with Clear Whey Protein Powder. Lactose-free, sugar-free, and refreshingly delicious. Perfect for a flavorful, protein-packed boost. That's Clear with a K. Clear Whey Protein Powder. A refreshing, high-protein drink that transforms your post-workout routine. Crafted with pure whey protein isolate, this innovative formula offers a light and flavorful alternative to traditional protein shakes. With 0 lactose and 0 sugar, it caters to those seeking a clean, transparent approach to fitness nutrition without compromising on taste or quality. Clear has 20 grams of protein with 0 sugar, 0 lactose, making it ideal for most diets. It helps build and maintain muscles as well as supports endurance and recovery. Just mix with water and avoid all the extra calories and thick, chunky taste of other milk-based proteins. Clear comes in sweet, fruity flavors like strawberry watermelon and wild blue raspberry. Check them out at https://clearprotein.com. That's clearprotein.com with a K. And for a limited time, when you use the code RUNWITHMIKE, all one word, during checkout, you'll receive a 20% discount of your total cart purchase. This is the highest discount available and exclusive to Running for Beginners listeners. Just use the code RUNWITHMIKE at checkout. Okay, back to the topic. And now on to the interview with Jake McCain of Advanced Physical Therapy. This afternoon, I'm here with Jake McCain from Clinical Manager for Advanced Physical Therapy in Neosho. And before we get started, I'm going to ask you to introduce yourself a little bit. First off, how many advanced therapy offices do you guys have?
Oh, we've got 6. We've got 4 in Northwest Arkansas and 2 in Southwest Missouri.
Okay, there we go.
Yep.
All right, so let's hear a little bit about yourself. Give me some background.
Yeah, so as Mike said, I'm a physical therapist. I got my undergraduate in exercise science with a clinical emphasis from Pittsburgh State University in Southeast Kansas. And I got my doctorate in physical therapy from Missouri State. Currently, I'm practicing in advanced physical therapy in Southwest Missouri. It's a rural setting, so I see all kinds of patients. I've been here for 4 years and, treat a lot of runners and a lot of other folks like that.
Outstanding. And just to be honest with people, because I know he's not going to say it first, I know Jake because I've actually come here for my own work before. I had a torn rotator cuff, my second one, and Jake was my physical therapist, and he put me through the motion. So I knew of him, and that's why when I was going to do this interview, I wanted to talk to you. So first things first, this is, a beginning running podcast. So a lot of runners are going to have aches and pains and all kinds of issues when they first start out in the first year.
Right.
This is our 12th episode. So I'm trying to culminate that within a year's running time, they would have dealt with certain things, how to eat, what shoes to buy, what races to do. And eventually, after a year of running, after you've never done it before, you're going to have aches and pains possibly.
Absolutely.
So that's why I wanted to talk to you. So should I see a physical therapist, PT, physio? When those terms are interchangeable, I would assume.
Sure.
When and why should runners get checked out?
So I would say you should start to think about seeing a physical therapist if you've got anything that's lingering. If you start running and you've got a lot of new muscle soreness or anything like that, sometimes people will freak out, especially if they're untrained,
right,
and they get very concerned. It's, I haven't had pain like this in this area. It's like,
right,
well, if that's there for 3 to 5 days, maybe a week, that's a very normal thing. But if something is lingering every time you run, it's this recurrent exacerbation of pain. I think it's time to, look at seeing either a physical therapist or a chiropractor, somebody that manages issues like that.
Right.
In that first year, the most common thing runners are going to experience is going to be musculoskeletal related. A lot of strain, soft tissue injuries, but you can also have some joint issues, if you've got a history of back pain or hip or knee, anything like that. So
okay. The aches and pains and when they recognize it or realize that you should go to see one or the two people, can they go to a physical therapist on their own? Can they just say, come into your office and do I need a doctor's referral?
So that's going to be state dependent,
okay,
actually. So federally, it's legal to go see one,
okay,
but then the states have to decide. In
okay,
Missouri, we can use where we're at right now as an example. In the last year, they've actually opened that up to where you can go without a referral.
Okay.
Now there's maybe some different things with insurances, like Medicare still won't pay unless you have a doctor's referral.
Sure.
But most commercial insurance, you can show up, or if you're a cash pay patient, you've got 10 visits to show improvement, and after that, if you're not showing improvement, you go see a doctor. With runners, a lot of times they're getting better at that point. So,
okay, so you can do it.
Yep.
Okay, great. You kind of touched on it already, but the second question I had written out was, at what point should the beginning runner consider seeing a PT? And you said, lingering aches and pains, but does it have to hurt first? I mean, is pain that? I've worked out for years and years and years, so I can tell the difference between, lactic acid buildup, muscle soreness, or I tore something or whatever. But a lot of newbies can't, and you touched on that. But
so in a setting like this, like most of the time when I get a patient, typically they do hurt first, but I'd say they don't have to, right? Particularly if somebody, maybe not your very new beginner, someone who's a little more in tune with their body and something just feels off.
Mm-hmm.
Maybe they've noticed their push-off stride has gotten, it's different in a longer run, or they're just feeling different. Maybe they're not hitting their times like they would, and they feel like that's related to their body. You can absolutely come see a physical therapist. It's going to be a little bit outside of that traditional
Sure.
evaluate what's the issue, where's the pain generator. It's all right. How do we develop a plan to deal with this before it becomes something, right?
Yeah, because I have some discomfort sometimes on my right glute area, and I don't know if it's just tightness, if it's my hips, if it's my sciatic, if it's whatever, but it's not painful. It's just noticeably different than the left side.
Right.
You know what I mean? So I should be a candidate where I shouldn't be the idiot. I know. I should have come in and said something, but I'm stubborn like that because I think I know my body well enough that if it lasts too long, then I know there's an issue. But
and you're going to have different things pop up like that, and it's not always appropriate.
Sure.
Sometimes you put a lot of miles on, and things start to arise. But if there is a modification you can make, something you can control to manage those symptoms, or make it to where maybe that comes along mile 10 of a half marathon rather than mile 8, that can be an objective difference you can make with it. So,
gotcha. So can you walk us through what a first visit would look like for a runner, and what should someone expect?
So the biggest thing, if you're a runner, you want your physical, and if your injury and your goals are running related, that's what you need that visit to be about. So your first visit with a PT should be sitting down and giving a history, telling them how long it's hurt, where it hurts, when it hurts, or when you're starting to feel different. And they should be curating treatment to that. I would say if you've got a physical therapist that you come in and you say, I've got a knee issue, and they say, great, no further questions. This is how we treat all knee issues. Maybe look elsewhere, right?
Gotcha.
Same thing for any provider. You want it to be curated to your goals specifically. As far as what that visit should look like, you're gonna lay out, what your concerns are and what that injury looks like, and then you're gonna do a physical exam. Physical therapist can kind of get a picture of that. Depending on the clinic, there may even be a running evaluation if it's purely a running issue. I put people on the treadmill in here. In a bigger clinic, you might be able to run in the clinic. I've been in some places like that as well. But again, if this is a running issue, we got to find out what's going on when you're running. So from that, they'll either prescribe, exercises or manual therapies and different modalities they might implement.
What do you mean by modalities?
So as far as modalities go, that's going to include your dry needling, if a hot pack or cold pack's recommended. In that case, probably not for a runner necessarily. It's not a big deal, but any cupping, taping, electrical stimulation, things like that.
Okay.
Pretty much, to keep it in a layman's term, simple application is anything that's not exercise that a physical therapist is either doing or prescribing.
Okay.
Then so at the end of the visit or towards the end of the visit, there should be, either a set of written instructions or good verbal instruction as to what the plan is going to look like, right? You've got to have that early on, saying, hey, this is going to be your warm-up routine. When you run this time, I need you to try it, see how it works. When we follow up, we'll kind of assess. Or if there's any other modification like that. A lot of times with runners, and this wasn't really your question, but
no, it's fine.
But the biggest thing you have to look at in a runner, particularly a new runner or even a seasoned runner who's trying to train for a different event that's upcoming, it's going to be a loading issue, right? And it's programming, it's dosage. So let's use the example of somebody who's maybe in their mid-30s, early 40s. They ran maybe through college and they took some time off, had kids, started a career, and they're like, I really love running. I want to get back to it. And they get after running like they did when they were, a sophomore in high school, right? Maybe they're like, think they've got it, and they're like,
right.
Well, I'm not going to jump to where I was when I finished, but I am going to kind of start how I started when I was 15. All right.
Sure.
Well, your body's objectively different at
right.
that time, and you're now an untrained individual. The dosage of your running matters more than anything. And a lot of times these musculoskeletal injuries or aches and pains that we get, strains, come from overuse, right? That's from my own experience. That's also just what the data would support, is most of the injuries with runners, like half to 75%, are from an overuse, right? You increased your training dosage, and now you've got this new pain. So we have to learn how to work with that if we back off, and how do we progress to where you want to be.
Right. The volume, yeah.
The volume, yep.
So you made a comment, and I wanted to touch on it before I forget, because it's kind of how I am. Do you work in conjunction with other providers?
I do.
Okay.
I do. So sometimes directly, sometimes indirectly. And what I mean by that is, I'll have people who have been maybe seeing a chiropractor for for some time and they've got something else that popped up. Either their chiropractor or their physician recommended, hey, why don't you check out PT for this? I've got some other ones where I'm in, pretty close communication for some of my higher level athletes that, we're going to talk between each other and share notes and everything to try to develop that plan. But I am
part of a team.
I would say it's very much, part of a team there. I don't ever take the approach of, well, I'm your physical therapist. I'm going to be calling the shots on this, right? I think the most important person in the team is the patient. They really are the ones calling the shots. And then, it's going to vary depending on what's going on, who else they need to see. If it's a massage therapist, a chiropractor, a acupuncturist,
gotcha.
A different physical therapist sometimes.
Okay. Well, I don't want to say that. He's a pretty awesome guy. All right. So is it better to see the PT for general screening, even if you're not injured? I mean, is that something where you'd want to go, look, I'm not to that point yet, but.
So it's an interesting question.
I mean, it seems weird because you almost want to sit there and someone's going to answer me and go, no, idiot, you're only going to go there when you're injured.
Right.
But
so traditionally, you're just seeing them when you're injured. And this has actually been kind of a hot topic in physical therapy for the last few years. They put some research out and it's kind of a mixed bag on whether it's beneficial or not. I think for someone in an athletic population, maybe I'd be interested to see what that would look like if they did a big randomized trial where some people did and some people didn't, and if it made any difference in their rate of injuries over a year or multiple years. But traditionally, you would be hurt. I would say someone who is regularly training and maybe if they have a recurrent issue or if they've got an old injury that they're concerned about, I think that regular screening, whether it's an issue at the time or not, is very reasonable, right? My personal feeling is if someone's otherwise healthy, I don't know that they would need to take the time and money to go see a physical therapist just because, right? And I would understand anybody that had that thought. It's just from my own personal practice.
Sure.
I think if you ask 10 physical therapists, you're probably going to get a spectrum of about 10 different answers.
Sure.
Right. But I do think it's an interesting question that we've been.
I guess the common or typical answer would be that it all depends. But
it depends. That's the one.
I hate
the
that,
classic PT answer. Well, it depends.
It's like everybody.
It where I see that is folks who have had a surgery in the past and maybe they're training for a new something new.
I can see where it'd be someone who's previously athletic or more athletic.
Right.
Let's just say not a novice, more intermediate or advanced, where they're going to go, you know what? I don't want this to be an issue, so I'm going to go see somebody and get the right techniques down to stretch
Absolutely.
or to do whatever. Where a new person might not know any better. It's, running is one of the simplest, oldest forms of exercise. Just get out and move your feet, whether you wear shoes or not even. I mean, so, okay.
And I'll also get people who, maybe they're regular half marathoners and, some kind of pulling on my experience, some maybe a little more specific, but, I've had folks who maybe they had a back surgery 10, 15 years ago and they run half marathons all the time. And they're like, you know what? I really want to run a marathon again. It's not an issue, but they'll come in and a lot of that will look like what we talked about a moment ago. Developing your training program and how to negotiate or navigate those symptoms if they do arise, right? How would you deal with that? A lot of times I think it's maybe more appropriate to have a running coach or a personal trainer for those things. But if you have a pre-existing injury, then that's where I would say,
Gotcha. Okay. So what are some common running related issues that you or your office sees in beginners that are totally fixable with, obviously a little guidance?
Right. So your most common things for a novice runner is going to be knee pain. That's typically patellofemoral pain syndrome. Shin splints can happen. Totally a loading issue, like I mentioned on earlier. I don't need to go over all that again, but if someone just really increases the dosage, and the black and white example of that is they go from a couch and they start running 5Ks the next day. Not the couch to 5K. That's actually a pretty good program, but they go from nothing to everything, and now, oh man, I've just got this splitting pain in my shin. Well, you're going to have to rest. There's some different modalities and stretches and things you can do, but really that has to take time to heal. But also along with the knees and the shin splints, ankles a lot of times get irritated with it. Sometimes it's not just patellofemoral pain. You'll get, some inside the joint issue, like a acute arthritis or a synovitis. The word escaped me there for a minute.
That's right.
Like the capsule gets irritated because you put a lot of stress on it. And then hips, butt pain, right? Extremely common. more often than not with a new runner, it's going to be, greater trochanteric pain syndrome, which is often related to muscles.
I'm
Not
sorry.
always.
Can you repeat that?
Greater trochanteric pain syndrome. So your greater trochanter.
I'm not going to repeat that. Okay.
So if you go on the outside of your thigh and just
Right.
poke for the top point that pokes out the most,
Okay.
it's called your greater trochanter. And
Okay.
you've got your gluteal muscles all attached there, right? So you've got your gluteus medius, your gluteus minimus. You've also got a piriformis attachment there and a few other muscles. Part of the gluteus maximus attaches there. That's the one we all know about.
Mm-hmm.
It's the biggest muscle in the body. It's very visible, but there's two other supporters under there that get really irritated. And they have a lot to do with the stability of your hip when you're standing or when you land in a running stride. And that gets overloaded all of a sudden, right?
Mm-hmm.
Again, that overuse we talked about where maybe you walk a lot, but now you're running, you're taking significantly more force through those muscles over and over. So,
Gotcha.
yeah,
I've dealt with a bunch of those things.
absolutely.
I'm your poster boy example. Prior back surgeries, runs half marathons. Oh, shin splints because he overloaded himself. Yeah.
Another one we'll see is, tendinopathies. Tendons getting
Right.
irritated. So Achilles tendinopathy is that's the big old tendon we're all familiar with. So you get pain in the back of your calf, essentially.
Right. Is that just stretching to fix that or help that?
So
I say fix. I don't.
where we sit on the research right now is actually, I spend all this time saying, it's an overuse, overload.
Right.
Tendons prefer to be loaded rather
Right.
than stretched, right? You can stretch it and sometimes you'll get that quick relief
Mhm.
for a few minutes, but to actually heal it, you have to put it under load. So if it hurts from running as much as you run, we're loading it a little bit too much. So the answer is somewhere between 0 and that.
Mm.
We had a kind of an obsession in physical therapy for a while with what's called eccentric loading for Achilles tendinopathy. And what that means, when I raise up onto my heels, it's concentric loading. The muscle is shortening.
Mhm.
When I lower down slowly, that's eccentric loading. The muscle's getting longer, but it's contracted. And there's greater force on a muscle when you're doing that and on a tendon. What we've found is that it really doesn't matter how you load it, what phase of the movement you load it. It just needs to be loaded to heal. That is particularly for your kind of chronic tendinopathies. For your acute stuff, if it's a brand new pain right there, you just have to rest it.
All right.
Which
So
is counterintuitive for what a physical therapist usually says. They want you to do stuff, but if it's new, you got to rest it.
right. All right. So before I move on,
Yep.
the tendinopathies. We're talking about the ankle. What other tendinopathies would a runner have where they would have to worry about the loading part or use?
So that would be
So the ankle tendinopathy.
so you can get it down in the ankle. More often than not, you'll get it in the back of the ankle and that Achilles. You can also get it on the outside. I've seen a few cases of what's called peroneal or fibular tendinopathy, and that comes down the outside of the ankle, kind of wraps around your foot. So feels like an ankle sprain that just won't go away. And then the other one is going to be gluteal tendinopathy,
Okay.
as we talked about. So I used the phrase greater trochanteric pain syndrome earlier because there's a lot of structures in there. So we start with an umbrella term. It's just pain right here.
Mhm.
And then it's your physical therapist job or whoever you're working with to decide, well, it's a gluteal muscle issue or it's a bursa or it's maybe even nerve related if it's something with your back or inside the hip. But that's very common when you're having in runners when they're having that outside pain is going to be tendinopathy in those gluteal tendons.
Okay. So those are the three that we.
I would say those, IT band syndrome gets tossed out a lot.
Mm-hmm. Is that a tendon?
Technically,
Okay.
it's the biggest tendon in the body. It's I think it's a little overdiagnosed.
Okay.
Personally, that's
Okay.
we can maybe go down that rabbit trail later. But it's
Okay.
yeah, it's an interesting one.
So how can a PT help improve my running form or efficiency? And I'm almost going to answer myself because you said you got a treadmill in here.
Yeah.
So is that how you would do it?
So another interesting question that you'd probably get a spectrum of answers, right?
Okay.
So I do gait analysis with almost every patient, whether it's walking or running, right? I'm watching how they move.
Sure.
For a long time, PTs had an idea that we could effectively change and fix how people walked and put them into the normal box. And that was what they needed to fix their issue.
Mm.
I don't take that approach. The research doesn't really support that, right? If you're just going at it to fix the gait pattern, I don't think it fixes the issue. The other thing is we're trying to fit you into this box of normal gait. And we got that we study thousands and thousands of people, and all these things kind of overlap, and like 70% of people are going to kind of have these patterns. But then you've got 30% of people that don't. And even within that 70, you're going to have variance of some kind. So I'm going to look at it to get the clinical picture. I don't know if I'm really trying to fix it, if that makes sense.
To change the form or anything. Yeah.
Right. Where, the phrase like muscle imbalances get thrown out all the time, where, oh, you have like a short hip drive, right? Mm-hmm. You don't drive your knees as high as somebody else. And they'll say, well, it's because you got weak hip flexors or you got tight glutes. Maybe somebody just has a shorter knee drive. That's fine.
I've been behind a bazillion runners, and I watch them, mm-hmm. their gait, and you would think, oh, that person's not going to make it a mile running like that.
Right.
Feet are flared out, gaits odd, they're swinging one leg. That's just mm-hmm. their body mechanics.
That's it.
And they're faster than me, or they're going like I never pass judgment anymore, because I've seen people going, oh, that's not right, or whatever. Right. I'm not to say that I have the right gait, because I know my right leg flares out a little bit, but it's their body, their gait. It works well for them. I mean, as long as they're not in pain.
Exactly.
Who am I to complain?
It becomes more of a focus if they're having pain and it's causing it, or if they're having pain because of how they move. Then I'm going to focus more on it. And I think you can make little changes where a physical therapist can be effective in that is, if we've identified something clear that we want to focus on, we can come up with a kind of a warm-up routine and maybe some mental cues to think about when you're running and training. Mm-hmm. To over time, you can build maybe a better habit for a better running posture, a better running stride. But they're very small changes over time. You're not going to come see someone and they're going to say, this is what's wrong with you. Do these things and it'll fix it, right? If you learn how to, it takes a while to learn how to ride a bike. It takes a while to transition from flat ground running to maybe running through the woods, like cross-country running. It's a very different thing. And it's not, you don't just do that overnight. It's over time. So if you want to change your running stride, it's little changes incrementally over time. It's a motor learning pattern. Let's see. I had something else when we started, but
That's all right. That's all right. I'm there all the time.
Oh, you mentioned feet.
Yeah.
That is a perfect example, right? So we can look at how someone's foot is going in or out, or are they a pronator or a supinator, right? And there's a lot of obsession with that, right? There's a lot of people with flat, overpronated feet that run and have never had a problem with foot pain or any lower extremity pain in their life, right? So we have to take that. It's a piece of the clinical picture. It maybe influences your pain, right? But that might not be the cause. You probably have been doing that for your entire life. And unless it's something that we think has developed over your entire life, I'm not overly concerned about it, Again, it depends, but it's not the first thing I'm looking at, where if someone comes in and says, I've got knee pain, it's like, well, I got to see your feet, because if one of them's flat, then, maybe you have a flat foot.
There's way the
before,
cause.
Exactly.
Okay.
So,
understand. Yep. All right. So what's the difference between, I'm asking this question because a couple episodes ago, I interviewed a chiropractor. Okay. Now I'm doing a physical therapist. So what's the difference between a PT and a chiropractor when it comes to running issues? This, from your perspective, obviously,
So for PTs and chiropractors specifically, my answer all along for my whole career has been, if whoever's giving you treatment is evidence-based, whether it's a PT or a chiropractor, an athletic trainer or whatever, if they're evidence-based, it's not going to look a lot different, right? Where I think just in the training, there's a lot of training for both of them, and you're going to see different things. A physical therapist is going to be a little more experienced and maybe lent to someone who's dealing with an acute injury or is post-operative if they just had a surgery. Your chiropractor, I think where they really excel is people who have just managing chronic pain, right? That can be some of their hands-on techniques, specifically the spinal manipulation and everything like that, which I do in practice, but I think it's pretty arrogant for me to say that for every patient that needs that I'm as good as someone who does that more often than their practice.
Sure.
Right? Not to say that every chiropractor does that for everybody every time, because they don't. Again, if they're evidence-based, they're probably not.
Right.
But I think their training lends more to that. So what I'd say, lean more towards a physical therapist if you're coming off of a bigger injury or something new. And the other time I'd say it is if you've gone to a chiropractor in your area and you've gone to the physical therapist and you felt like the physical therapist helped you more, it's going to be region dependent. Who do you have available?
Sure.
Sometimes you're going to have a better approach for you from a physical therapist. And likewise, in a different city or a different area, or even a different patient with a similar issue, but just works better for them, go see the chiropractor, right? Okay. So, hate to say it depends,
it
but
depends.
It sure does.
I like that. No, those are great examples. All right, so let's assume that it's not me. I have a small farm, but let's assume, so my injuries are totally different. Let's assume I have a desk job and poor posture as I sit up right now in my chair because I'm self-conscious. Can a PT help prevent that? Yeah, my wife. Book straight posture. It's
all the time.
It's offensive. I get so mad. She's really on it. Sorry. Yeah. All right, so I can edit all this stuff out. So
that's fine.
If I've got a desk job and poor posture, can a PT help prevent that from affecting my running? And I'm trying to tie it into the desk job, like a couch to 5K thing. Yeah. We got a desk job to our form, our posture. How's that going to help when running if I'm a poor posture person?
So again, that's a really interesting question because I think of it from a different perspective more often.
Okay.
Right. So we've got pretty good data that says people who work desk jobs are a pretty high risk for musculoskeletal disorders. Actually, if we look at work injuries, your folks who work very repetitive factory jobs are going to be your highest risk, right? Truck drivers also have a pretty high risk just because it's very repetitive, sitting and grinding, and it's very sedentary. But up in that top 3 or 4 is a desk job, right? To develop some kind of musculoskeletal pain. And you wouldn't think that because it's not active, but you're sitting for 8, 10, 12 hours a day. And that's very detrimental to the body. So one of the ways you can alleviate that if you work a desk job is to get physically active. So I'm usually looking at it, I'm trying to coax people into starting something.
Right, get out of the chair.
Your question is an interesting one. Like you said, how can you prevent someone from developing injuries if they work a desk job? For one, get active and stay active. That certainly helps. You're on the right path. Where a physical therapist can maybe step in if you're having issues specifically because of your desk job. I do ergonomic assessments all the time, and there's a few little changes you can make often, right? And it's different. There's 12 to 15 points that I'm looking at. A lot of it has to do with the chair and monitor height and things like that. But if you're sitting for 8 hours a day, hunched forward, leaning at a screen, you have a certain load on your spine or your hips or your back, and you can make a little change to where it's a few pounds of pressure difference on whatever joint is maybe affected for that 8 and 10 hours. I've said from the beginning of this, everything really comes down to a loading issue.
Mm-hmm.
So it's very low load, but it's a lot of time. It's a lot of accumulative stress. So how do we relieve those stresses? I guess to summarize, I wouldn't discourage anybody with a desk job to start getting active. I don't think it places you at a higher risk of injury because you work a desk job. Quite the contrary. If you're getting active, you're lowering your risk. But maybe it is appropriate to see someone that, has some ergonomic knowledge to make those changes.
Now, you said you do ergonomic assessment?
Yep.
Is that standard PT practice or just something that you have been trained in do in your clinic? Or do you think most other, like at some PT in Massachusetts, do you think they do it too?
So I think anybody who's been to PT school has definitely talked about it.
Okay.
It is something I have done continuing ed on. I took, some extra schooling on it. And I also, this is specific to me, something I do is I go into workplaces for injury prevention. And so I'm doing ergonomic assessments a lot of the time where I'm working with people who either work desk jobs or factory jobs.
Right. Okay.
And how do we make changes there? So it is going to vary. Some people are going to look at it a little closer. Some people are going to have a little more experience in it. I think
it's not going to be uncommon then for someone to find somebody.
I think most PTs are going to have a general understanding of it and, be able to look at it, right? At least on some of those really big changes you can make.
Okay. How do you approach recovery plans? After a run or a long run or a training plan, time frame, so a recovery from a 6-week training plan or whatever it is, and we're running. How do you approach those recovery plans? And are they cookie cutter, personalized?
So everything's got to be personalized. Earlier you mentioned what it should look like at your first visit in PT, and I would fall back on that to say from the jump, this should have been personalized to your goals, get you back to what you want to do. Be that running, fishing, hiking, hunting, whatever it is that you want to do. It needs to be geared towards those goals. As far as when you say a recovery plan, are you talking about recovering from an event or recovering from specific?
Well, from both, I guess. Depends if you got.
So,
yeah.
If you're recovering from an event, it's going to vary. It's going to vary depending on that person's age. Are they recovering from a 5K or a marathon? Do they have another event planned in the future? Right. If not, we can talk about what a maintenance load looks like. If they are going to build up for another event in 2 months, okay, we can talk about how you would kind of taper off and build back to that to not lose anything. You don't want to, run a marathon and then go out and train for your next one by running a marathon the next day.
Gotcha.
But you also don't want to start sitting on the couch for a couple of weeks. If it's injury specific, again, it's all going to matter, or just pain, or not even if we're dealing with somebody who doesn't have that pain and we're trying to avoid it, that's all going to look different, right? So yes, okay. It's going to be very specialized to whoever it is.
All right. So what are 2 or 3 signs that a beginner runner should absolutely not ignore and should get checked out like ASAP? I mean, it sounds kind of, again, counterintuitive. Yeah. It sounds almost like everybody should know their own body, but let's hear it.
Let's hear it. How many people don't.
Let's hear it from the professional.
Particularly in your untrained individual.
Okay.
Right?
Right.
So anytime you have a new pain that is localized and is either arises every time you run, or it is lingering beyond that week point, right? Week in duration. Mm-hmm. Again, if you maybe have been training for a little while even, and you had a particularly hard day planned and you ran hard, and now you've got this diffuse leg pain, it's pain on both sides, it's pretty similar. All right, you probably have, onset muscle soreness. It's going to be all right.
Right.
Okay. Probably even going to feel better if you trained the next day. But if it is that plus, man, it really, like, this knee is just sharp. It's right. Just sharp. And maybe not when I'm walking, but every time I start to run, it's getting worse. It gets worse by the end of the run. Then it's time to, so I'd say the 2 or 3 signs are pain that is not going away, and pain that is getting progressively worse with your training, and pain that's very localized to one area, right? Or is a very specific, maybe it's radiating pain, if it's related to a nerve or your back or something, but it's on one side of the body.
Right.
Things that you're experiencing on both sides,
it's probably
write it off unless it's lasting a very long time.
Sure. Okay.
Yep.
Yeah, that's what I was going to say is keeping active, the sedentary part, for an office worker or whatever, desk job person. I, being 2 back surgeries, 2 shoulder surgeries, I feel like the Tin Man if I don't do something. Right. And I need to exercise and move to not what I call knock the rust off.
Right.
And then I feel better. I feel more lubricated in the joints and the muscles and the spine if I get out and do something. If I take a couple of days off, the simplest thing just throws me for a loop because of that. And
Absolutely.
I think it's just about keeping active.
Absolutely. I love.
But I know my body, so
I love to treat runners and anybody who's a motivated athlete for that reason. I'd say 75% of the people I get in here, I am trying to coax them to do more. Right? People who are runners and that's their outlet. When my job is to kind of pull the reins a little bit, they don't always like that, but it's so much easier mm-hmm. from a PT's perspective of somebody who they're going to continue to do what they're going to do.
Right.
And they're active and everything. You're doing the biggest thing that most issues need is to get active, improve the blood flow. Exercises has shown for so many different issues to be a positive. You kind of mentioned you were a patient of mine, mm-hmm. so I'll kind of touch on that. When you came to see me for your shoulder, you were more active than a lot of people I have. You continued going to the gym and you were on the treadmill and running and things like that, and your healing went a lot faster than most, particularly anybody who's sedentary. If I can get somebody to use their gym membership or go get a gym membership and walk on the treadmill 30 minutes a day, that healing time is so much better. And it seems like we have so many less complications with it, and then I don't have to take time out of the clinic to put them on the treadmill or something like that.
Sure.
We can focus on, the issues there. But with any of your runners, Wow, I lost my train of thought.
It's okay. I got the magic edit button.
I was going to say, you're going to need it
I got them all. I cut out all my ums and ahs all the time.
Yeah, but when you go back, you kind of mentioned the start of that topic where you like to stay active.
Yeah, I like, because you talked about the desk job person, the sedentary job, and I like to stay active because of my previous, medical history. I need to knock the rust off, and if not, I just feel terrible. So getting out and being active, even though if I don't do it, like today, I didn't exercise, I didn't go to the gym, it was my day off, but I'll probably be a little achy, because I didn't go. Because of this and that and the other thing. It won't be the mental thing. I'll know my back will be tweaky or fun. And then, obviously you get weird things like weather and barometric pressure messes with me. But in general, if I'm active, all my aches and pains feel better for me.
Yeah.
I'm not someone I'm not going to sit there and tell someone to run through the pain or work out through the pain, because that's just not smart. As long as they can identify what it is. Like you said, if it was just muscle soreness, you're 100% correct.
Yep.
I ran 6 miles the other day on the treadmill. I'll run it again and it'll knock off that feeling, but that's what works for me, is just keeping active helps me.
Absolutely. And sometimes, my role, whereas I'm talking about, pulling the reins back on somebody is not, I'm not telling them, oh, it's, you've got this issue. You need to be bedbound. Right. That's almost never the answer either. Right. I've talked about a few things earlier where it's like, well, you need to rest. When I say that, I don't mean you've got to sit on the couch. But you need to decrease the amount of, physical stress you're putting on that area. So maybe it's backing off to a maintenance load, or, you cut your training volume in half for a couple of days. Active
rest days, where you're not doing that thing. In this case, this topic would be running. I'm not running, but I'm still out, walking with the dogs or doing something else.
Or if there's someone who's maybe they're a runner and they also like to lift every now and then. All right, we come and we develop a plan for this amount of time, maybe we're going to focus most of your days on kind of some upper body lifts, and we'll do some lower body stretching for relief. But you're going to get that heart rate up, remain active, get all the benefits of exercise that you get globally for healing. But we just kind of reduce that amount of stress on that issue or on that area.
Gotcha.
Yep.
All right. So I had a couple questions written down, obviously,
sure.
And I went on one or two rabbit holes. But what I like to do towards the conclusion of this is, because I'm not the expert, and I touched on this one before the cameras were on, I'm not the expert, you're the expert. Is there something that I missed that you would have wanted me to ask you or thought I should ask you, or I don't want this to end without these listeners knowing this or thinking about this or whatever? I mean, how would you
want somebody, whether it's your chiropractor, your personal trainer, or your physical therapist, you want them to look at the total load, the total amount of stress and intensity on that area, and if that can be adjusted. If we have that addressed, then it gets a lot more specific to someone, right? Something we do a lot in here includes like dry needling, right? I've started doing it a lot more in my practice over the last year even. That I can be a lot more targeted to a painful area, and particularly with people who are training for an event, or I've got, some different sport athletes and things like that. We can manage pain before or after, and, with things like dry needling or with different electrical stimulation.
Like a TENS unit?
You can use a TENS unit. Yeah, absolutely. That's kind of what I'm talking about. Okay. I don't think those are the end all be all, but there is a place for it. And, right about the time where I think this is a waste of my time and all that, I'll have a patient comes in, and that is the key to their thing. So we'll do it. But implementing some of those modalities with that loading modification. Another thing I think that's, incredibly important, particularly, your new runners or people with new injuries, is your nutrition, right?
Good.
Now, I'm not a nutritionist. In my exercise science training, I get some pretty general nutrition education, and as well as in my doctorate for physical therapy, we discuss it. Usually I'm talking in a very general 1,000-foot view with people. I think if it's something you have a concern with, you should really see a nutritionist or a dietitian.
How hard it is to get one of those people to sit down with an interview for you? It's almost as hard as a PT. Because I have a nutritionist acquaintance that I really want to nail down for that, for the exact same reason.
Very cute. Like I'll listen to that one right away.
Gotcha.
I think that's something that gets overlooked in recovery, rehab, and training. as much as anything, because there's so much information out there, and it feels like every couple of months there's a new fad diet, and it's got this benefit and that benefit. There's intermittent fasting. There's longer term fast.
Oh, I know.
I try to stay out of the weeds with people, but a thing people miss a lot of times is the protein intake, right? So for weight management, maybe they started running for health benefits.
Right.
Okay. It's very hard to outrun a bad diet.
Sure.
So you've got to watch. I've had a number of patients that, I make them, I ask them, and if they want to do it, it's up to them. But I suggest they do a physical pen and paper journal of everything they ate, or get an app where they're putting in everything for a week.
Yep.
Right? Because people don't realize how those calories add up. And also, what's in that food. Is there a lot of protein in it, or is it pretty sugar laden? I'm not versed enough to speak on the correlation between, like a high sugar diet and inflammation, but there's something out there and it's worth looking into. Protein, it's the building block for any healing. So if you've had a surgery, you've got to typically increase your protein intake. If you've got a new injury, or if you've increased your training volume, probably need to look at that protein intake, so you're getting that recovery appropriately. Our body operates on a stress recovery adaptation cycle. We run a certain amount, we put stress on there. As soon as we're done, we start a recovery period where our body is going to, repair damaged tissue and adapt muscle, make it either stronger, build more mitochondria to build endurance, whatever it is. But if we don't have the building block, the protein for that, you're kind of wasting all of the output you did to break that down.
Gotcha.
And then during that is sleep as well. But then, on the good side, if we cover all those things, we get the adaptation. That's the coolest thing about being a human. You know what
Sure.
I mean? Is physically, is if we stress it and we take care of the body afterwards, it responds typically positively. So
Thank you very much for your time. I really
absolutely.
appreciate it.
I appreciate the opportunity.
I want to give a heartfelt thank you to Jake McCain of Advanced Physical Therapy for the time to speak with me and share his professional insight into some common runner injuries and how a PT might help you. Also, the content shared on this podcast is for informational purposes only and should not be considered as medical advice. The views and opinions expressed by the hosts or guests are their own and do not reflect the official policy or position of any medical organization or institution. Always consult with a qualified healthcare professional before making any medical decisions or changes to your health regimen. This podcast is not a substitute for professional medical evaluation, diagnosis, or treatment. We encourage you to seek guidance from a licensed healthcare provider for any medical concerns you may have. You know that running injuries can be common, but many can be prevented with proper loading and paying attention to your own body mechanics. Listening to your body and seeking medical advice in whatever form you feel is needed in a timely manner are crucial steps in maintaining long-term running health. Like I've said in episode 10, for new runners, injuries can be, unfortunately, a part of the learning process. However, recovery from many of these injuries can be sped along with the proper knowledge and preparation and treatment. Remember, running is a journey, and a PT might be just what you need to have a long and enjoyable one. Thanks for listening. I hope you hit the like button, follow the podcast, and share with your social media contacts. You never know who in your circle has wanted to run, but for whatever reason was too shy or fearful to undertake the challenge. I hope to point out the inclusiveness of running and give information that is accessible and relatable from a relatively new runner's perspective. Don't forget, if you're responsible for your own health, please talk to a doctor if necessary before starting any new physical activity. This podcast was created, written, produced, edited by myself, Mike Fleming. The show music is Every Day to Play by Ethos.
I hope you pressed play.
Yeah, I know. That's the thing they tell you to check on all the time. I earn a commission if you use my code on any of the products in today's episode.